you probably want to be cautious about staying on those drugs through a pregnancy.
Right.
Even berberine is, it crosses the placenta. So what that means is, if you get pregnant and you continue to take berberine, the baby is getting berberine.
Exposed, yeah.
Yeah. And there are a couple of studies where they've kept women on the berberine throughout a pregnancy, especially in PCOS patients. Compared to placebo, it was really significantly improving pregnancy rates in PCOS, women with PCOS. And relatively small studies, maybe a few dozen patients. So the fact that there were no major congenital anomalies or birth defects, that's great. But until you really look at hundreds and hundreds, maybe even thousands of patients, I don't think you can be too confident or too sure of yourself. Yeah.
Yeah. I'm glad you brought this up, because this is something we use quite a bit in practice with berberine specifically, but I'm always counseling people, like, we just don't, and this is true for all herbs, like, we just don't have the safety data in pregnancy. We're not, it's unethical for us to run studies, not me, but like others, to run studies in pregnant women. And so we have to be a little bit extra cautious. So how do we continue to support your blood sugar regulation through pregnancy if you were using berberine to help you get to that point?
Well, even metformin, the drug that has been prescribed to women with PCOS to help control blood sugar and lower insulin levels for probably maybe 50 years, a long time, is this drug called metformin. Okay. It's not an easy drug for a lot of people to take. It has pretty significant GI, stomach side effects. It's something, some studies say 20-25% of people who start on it can't continue. They just give up with it because of the side effects. But interestingly, it's what the FDA here in the States calls a class B drug. In other words, a category B in terms of safety during pregnancy. The FDA has sort of three categories, A, B, and C. C means this is really dangerous. We know it's dangerous. We've got to stop this, during pregnancy. A means this is fine. We know it's completely fine and safe during pregnancy. Things like amoxicillin, drugs that have been around for a long time and have a really good safety record. But there's a huge number of drugs that they call category B, which essentially means we're not sure. Okay. And that's where metformin is. Okay. Now, plenty of women that have taken metformin, women with PCOS, that have stayed on metformin through their pregnancy. But the official word is, probably better to stop it because we can't be certain. So if berberine crosses the placenta and we're not certain of its safety, and metformin, we're probably looking at the inositols as being a really great option for women with PCOS who then get pregnant, to stay on it. If it helps you get pregnant, which it will, great. You don't stop it. Stay on it through pregnancy. There's now 6 or 7 studies that have been published looking at whether or not inositol supplementation will reduce the risk of gestational diabetes, diabetes in pregnancy. And, women with PCOS, their risk is about, I think it's like 300% higher to get gestational diabetes. And if you stay on inositols through your pregnancy, it cuts that risk in half. It drops it by 50%. It also reduces the risk of preterm labor, premature birth. So inositols are totally safe through pregnancy. And in fact, if a woman has PCOS, they're a terrific idea to stay on it.